idea being pushed by Pennsylvania Senator Bob Casey, proposing free medical coverage for every American under the age of 19. It's the focus of a new bill. According to data from the KFF enrollment tracker, more than 7 million people have disenrolled from Medicaid since June of this year, and that includes more than 3 million children. Joining us right now, Carrie Sheffield, conservative commentator, and former Supreme Court law clerk Ian Samuel. So both of you here to discuss a little bit more about this. It sounds aspirational to provide all children health insurance for free. I mean, somebody's paying for it. But is there a detriment to a program like this?
Yes, there is, absolutely. And yes, it is not free. It is absolutely not free. Those children will be paying for it as adults, as will their children's children. So we have to keep that in mind. And this proposal, look, there is a place and a time for a safety net. I used Medicaid when I was a child, but that's because my parents lived in sheds and tents. We were on welfare when I was a kid, and we were actually poor. And what Bob Casey wants to do is to give it to rich children. He wants to give it 100% of children. And this will risk the safety net. Medicaid is meant to be a safety net for the poor. And what he wants to do is to jeopardize it by giving health care to rich children and subsidizing, taking money from poor and middle class families to subsidize the health care of rich children. It's a spectacularly bad idea, especially because the government running health care is known to be riddled with errors. NBER, the National Bureau of Economic Research, found in December 2021 that Medicaid loses 17.4% of billing claims compared to only 2.8% of private health insurance claims. So we need more private health insurance for these kids.
Well, it certainly would require some oversight to make sure a program like this was used effectively. But Ian, we have Medicaid for low-income families. We have the CHIP program for children from families who are middle class. Why do you think the senator is pushing for insurance for all children?
I will tell you why, and this is probably something that my friend's parents could explain to her. What the problem is with programs like Medicaid that require you to demonstrate eligibility is that there is a huge procedural paperwork hassle. You have to demonstrate with forms and income statements and tax returns, which low-income people may not even file in the first place, that you are eligible year after year. And so as a result, many people who are eligible for these programs are not actually enrolled in them because these paperwork hassles and paperwork overheads, which my conservative friends are always so concerned about in so many other contexts, but don't seem to be able to empathize with here. These kinds of paperwork hassles and overhead mean that eligible children aren't being covered. I think it is quite preposterous to say that the children and the children's children of these people who will be enrolled in these programs are going to be ruining the day that they were provided health insurance as children. I happen to think that all children, even the ones who are, maybe middle class one year, poor the next, et cetera, should be able to have health insurance in this country without making their parents into these amateur insurance actuaries running around filling out forms all day long instead of working and raising their children. And I think that if conservatives were really serious about family formation in this country, if they really cared about making it possible for young people to start families, this would be such an obvious no-brainer. Anyone with a child, I have a 4-year-old son, and I can tell you, they need health insurance. They need to have wellness visits. They need to go to the doctor when they have weird fevers. Everybody knows that. And there is absolutely no reason in the world not to spend a tiny fraction of our GDP ensuring that all children have health insurance from the moment they're born with no paperwork documentation hassle. It's a very, very simple idea.
So
very good.
Really quickly, Ian, a follow-up. No, go ahead.
He just illustrated my point. The fact of the matter is government is spectacularly terrible at managing healthcare. So he just illustrated my point. The fact that 17.4% of Medicaid physicians' billing is going to err compared to 2.8%.
What does that mean? What does that 17.4% thing mean?
Excuse me, I did not cut you off. Excuse me. You're cutting me off.
What does that mean, Carrie?
Excuse me. It means that 17.4% of when physicians are going to file their claims, they are coming back in error, and then they are denied the funding for Medicaid.
So those children don't qualify.
Coming back in error. What does that have to do with enrolling children?
So there's a lot of fraud, and you know what else we found? 1 out of every $7 went to fraudulent people for the COVID payment. So essentially, my friend here,
what
Ian,
does that have to do with enrolling children?
It has to do with the fact that there's a lot of waste, fraud, and abuse in government programs. And the fact of the matter is only 4% of children, according to HHS, are uninsured. So you want to bring in a lot more kids into a government program that has spectacularly more waste, fraud, and abuse when we should be focusing.
You're complaining about its reimbursements for doctors, not the patient.
I'm sorry, you spoke for a long time and now you're trying to cut me off. But anyway.
I'm just trying to understand your position, Carrie, and I'm not sure I do.
Carrie and Ian, there is a statistic that only 4.2% of children in the U.S. are currently uninsured. So there are programs right now, whether people are paying out of pocket for medical coverage or they're receiving assistance through one of these CHIP programs or Medicaid. It's happening for most of the children in this country. But under this particular program, every child born in America would receive free, in essence to them, health insurance. Ian, clearly you are in support of this.
Yeah, that's right. Because first of all, 4% of kids is still a lot. There are a lot of problems that affect way fewer than 4% of children that my conservative friends spend all day long screaming about. And so I think 4% of kids being uninsured is way too many.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.